Taking a blood culture specimen is very important, and here at Las Colinas Medical Center, we want to ensure that you understand and follow the process to help us serve our patients. Before collecting a blood culture specimen, you need to make sure that you have all the proper equipment. You will need gloves, suitable skin antiseptic, blood culture bottles, a butterfly vacutainer holder or needle, syringe, transfer device, alcohol pads, bandage, and a permanent ink pen. First, the patient must be properly identified and consent to the procedure. Take this time to ask the patient about their day and explain the procedure to them. Then follow the normal identification protocol to find a vein. After identifying the proposed venipuncture site, release the tourniquet. Proper disinfection takes time, and CLSI standard H3A5 states that the tourniquet should not be left on longer than 1 minute. Now gather up your aseptic supplies. Proper aseptic technique aids in accurate diagnosis by reducing the risk of false positive results due to contamination. Bacteria exist on the skin surface and can be temporarily removed by vigorous scrubbing with an effective antiseptic solution for 60 seconds. Antisepsis does not occur instantly. A 60-second wait time allows for the antiseptic to be effective against skin surface bacteria. In that time, cleanse the culture bottle stoppers. Using 70% isopropyl alcohol after removing the cap and covering with an alcohol pad until inoculation will help to ensure a clean culture. Next, you will want to mark the minimum and maximum fill lines on the culture bottles. Typically, adult blood cultures require 8 to 10 milliliters per bottle, while pediatric blood cultures require 1 to 3 milliliters per bottle. Now you are ready to draw blood. First, reapply the tourniquet and perform the venipuncture without touching or repalpitating the site. If the patient has difficult veins, you may need to relocate the vein. If you do, the gloved palpating finger must be cleaned in the same manner as the site, including the 30-second wait time. Repalpitating should only be done above or below the site of the needle entry. Media inoculation can occur directly into the bottle during specimen collection or after collection when a syringe is used. After you have completed the specimen collection and removed the needle, properly cover the site with gauze and tape or a bandage. Now you are ready to label the specimen containers with the required identification information, including the site of the collection, as an example, the right arm. Noting the collection site is necessary in cases where there is a localized infection. Specimen labels should also include the time, date, and initials of the person collecting the blood. Properly dispose of the used and contaminated materials in a biohazard container. Now you may remove your gloves in an aseptic manner, sanitize your hands, and thank the patient. Thanking the patient is courteous and professional. You may take blood cultures quite regularly, but in the patient's eyes, this may have been seen as an ordeal. Finally, you are ready to transport the specimen to the lab. Prompt delivery to the lab protects specimen integrity. Place the specimen bag in the container and send it to the lab via the tube system. Now that you have seen the entire process, let's review. Be sure to be friendly to the patient and thank them. Swipe the tops of the bottles with alcohol. Clean the draw site for 60 seconds. Let the draw site dry for 60 seconds. Blood culture specimen collection at Las Colinas Medical Center.